How to tell if flu symptoms are pneumonia. Understanding whether flu symptoms have progressed to pneumonia is crucial for timely medical intervention. Influenza and pneumonia are distinct conditions, though pneumonia can sometimes develop as a complication of the flu. Influenza, commonly known as the flu, is characterized by several symptoms. You may experience a high fever, often over 101 degrees Fahrenheit, lasting 3 to 4 days. A prominent headache is common, along with severe muscle aches and pains. Fatigue can set in early and may last 2 to 3 weeks. A dry, hacking cough often accompanies these symptoms, and the onset of flu symptoms is typically rapid. On the other hand, pneumonia is a serious lung infection that can be caused by bacteria, viruses, or fungi. Symptoms of pneumonia include a high fever that can rise rapidly, a deep and loud cough that often produces mucus or sputum, and common chest discomfort or pain. You may also experience frequent shortness of breath, and the onset of pneumonia symptoms tends to be more gradual compared to the flu. There are key differences between the two. Flu symptoms appear suddenly, while pneumonia develops more gradually. Pneumonia causes more severe respiratory symptoms, such as a deep cough and chest pain. Additionally, the flu is associated with more body aches compared to pneumonia. You should suspect pneumonia if you experience a severe cough that worsens over time, shortness of breath or difficulty breathing, chest pain or tightness, or a fever that persists or worsens. Diagnosing pneumonia typically involves a physical examination, where a healthcare provider listens to your lungs with a stethoscope. Imaging tests like X-rays may also be used. A healthcare provider can determine if flu symptoms have progressed to pneumonia and recommend appropriate treatment, which may include antibiotics if the pneumonia is bacterial. If you notice that your symptoms are worsening, it is important to seek medical attention, especially if you are in a high-risk group such as the elderly, young children, or those with chronic conditions. Monitoring your symptoms closely is vital, and you should report any changes to your healthcare provider. Always follow prescribed treatment plans, whether for the flu or pneumonia. In summary, while the flu and pneumonia share some symptoms, distinct differences in symptom onset, severity, and type can help you identify if flu symptoms have progressed to pneumonia. Always consult a healthcare professional for a definitive diagnosis and treatment plan.